We've been called to a patient who has fallen from a 2-metre high tree while using a saw to cut a branch. Their chief complaints are a sore right lower leg and a laceration on their left arm. Upon arrival, I can see that we're in a nice residential area. We have good lighting and nice weather. There's no branches above that could harm us, and the branch that fell is to the side of the patient. We have our PPE gear on, such as our glasses and our gloves. Are you ready to go in?
Yeah.
Yep. Hi, I'm Symara and this is my OSCE Tara. How are you feeling today?
Oh, just sore arm.
Oh yeah, that's quite a lot of blood. So my patient has a GCS of 15 as she is responding to pain and my voice. Now I can see that she's got a large laceration on her left forearm, which is about 15 centimetres long, and there's quite a lot of blood coming out. So firstly I get the saline and clean out any dirt in the wound, and then get the combined dressing and fold it to the appropriate shape to get the smallest surface area on the wound, and you apply saline to avoid that sticking when the dressing comes off. So we apply this with direct high pressure to try stop the bleeding as much as we can. Can I just get you to hold that, and we'll elevate it and just hold it tight. And to keep that on, we will apply a bandage. And to increase the direct pressure, we turn the bandage when we come across the laceration. I can see that the wound is still bleeding, so I'll apply some more combined dressing and another bandage. Again, we fold this to the correct size with the smallest surface area and applying direct pressure. And again, we can cross it over to increase even more pressure. So after applying 2 bandages, it still looks like it's bleeding. So this is when we would apply the tourniquet. Now when applying the tourniquet, you want to make sure it is 10 centimetres above the wound. And since her laceration is quite close to the elbow, we'll be putting it above. And then you just tighten that as tight as it can go to stop the blood flow. So I'm just going to check the bleeding after applying the tourniquet. And it looks like it has stopped bleeding. I'll just check the radial pulse for this. And I can't feel one. If it was to continue bleeding, that's when you would apply a second tourniquet. So do you want to keep this up while I do a trauma sweep? So I'm just going to do a trauma sweep on my patient to check for any other injuries. So I do this by squeezing the body. You tell me when it's sore. It's sore there?
My neck.
Your neck?
Yeah.
Okay, so we have tender C spine pain. I'll continue going down her body, checking for any pain and blood. Is that sore? And that's not sore?
My ankle.
Oh, and we have a sore ankle. So I'm just going to expose the area and gently take the clothes off and compare the other side. So that looks like a fracture. Now since she was complaining of spine pain, we'll just have to apply a collar to her neck. To do this, I measure my fingers from the shoulder to her chin, and then again on the collar. You right to hold it up? Yep. So we're applying this collar since there's C-spine pain, there's a suspected spinal injury. So applying this can reduce any more injury if it is to be moved. So we just slide this under the neck. And complications of this is that it can be quite uncomfortable. Is that alright? So now that we've applied the collar, I'm just going to take some of your vital signs. Is that alright?
Yeah.
First I'm going to take your heart rate. I'm just going to squeeze your wrist. To do this, I'll squeeze the wrist and find the radial pulse. You count the pulse for 15 seconds and times that by 4, checking the strength, rate and regularity. A normal heart rate is between 60 and 100 beats per minute. Now I'm going to take your blood pressure, is that alright?
Yep.
So I'm just going to expose the area and apply the cuff. This might get a little bit tight and uncomfortable, but it won't last long, okay? So to take the blood pressure, we pump the cuff up until we can no longer hear the systolic pulse and take one more pump. So I'll slowly release the pressure. And when I hear the first beat, that's the systolic pulse, and when I stop hearing it beating, that's the diastolic. So a normal blood pressure ranges from 100 to 140 for systolic and between 60 and 90 for diastolic. If it was to be higher than the range, it would be hypertensive, and if it was any lower than that range, it would be hypotensive. So now I'm just going to take your respiratory rate. Normally you'd do this when the patient isn't aware, otherwise it can affect the results. But to do this, you watch the chest and abdomen rising for 15 seconds and you times that by 4.
Auscultate. We use the stethoscope to listen to the clarity of the lungs.
Your chest. Yep. And just take deep breaths for me. So we're just listening to the apex and the base of each lung, anteriorly and posteriorly. But in this situation, we only take it anteriorly as she has a sore neck and we can't get her, take it from the back. Is it alright if I just lift your shirt up?
Yep.
So I'm just listening to the clarity in the air and the lungs and checking for any crackling or wheezes. And that sounds good. So after taking the patient's vitals, it seems like she could possibly be in mild shock. This would result in an increased heart rate and increased respiratory rate. Her blood pressure could also increase depending on the laceration and if it was still bleeding, but we seem to have that controlled, so her blood pressure's fine. Now since she's in mild shock, we will want to give her oxygen. To do this, I'm going to give her oxygen through the nasal prongs. So we're just attaching it to the bottle and turning it on with a flow rate between 2 to 4. And we would put the nasal prongs up her nostrils and put it around her ears. Also, since she's in shock, we want to keep her warm. Alright, if I put this on you? Yeah. Yep. To assess that, I'm just going to look at the fracture. I'm going to be comparing both legs. So just checking the pulse on the affected foot. There's still a pulse, quite similar to her other foot, and her capillary refill time. 2 seconds, so that's good on both feet. Just going to do a neuro assessment of her feet. Can you wiggle both your toes? Yep. Okay. Now is this quite sore, Dana?
Yep.
Yep. So before we manage the fracture, it's best to give her some pain relief as she'll be in quite a lot of pain. Dana, have you ever heard of methoxyflurane?
No.
No, so you haven't had this in the last week?
No.
No? Have you ever heard of malignant hypothermia, or has anyone in your family ever had it?
No.
Nope, and you obviously don't have any allergies to it since you've never had it before. You're obeying my commands, so that's good. And have you got any renal impairments? No. So in one capsule there is 3 mils, and an adult can have up to 6 mils. Now this is going to make you feel a bit nauseous and dizzy, but it will help your pain and make you feel better. So if you breathe in and out through it, make sure you're breathing out through it. Yep. Well done. Deep breaths, and that will help with your pain. We can also give the patient some paracetamol to help further with her pain. Have you had it in the last 4 hours? Paracetamol, no, and you have no allergies, and you haven't been poisoned by it. No. And that will also help with her pain. Between 50 kgs and 80 kgs, you can give them 1 gram, so this patient will be having 1 gram. So I'm just going to put your leg in a splint, Dana, to help immobilise your fracture. So to do this, we do it with the splints, and we use a towel to help immobilise it. Okay, so are you able to grab the leg above, on either side of the fracture, and I'm just going to slide this under. Cool. That's ready. 3, 2. I'm just going to use triangular bandages to tie the splint to the leg, and we're doing this above and below the fracture. I guess we can reassess the baselines. Yep, still pulse. Can you wiggle your toes for me? Yep. How's the pain feel now, Dana?
Still really sore.
Still really sore? Okay. AUT 1 to COMS requesting an additional ambulance with either a paramedic or an ICP. My patient is still in a lot of pain and requires morphine. We gave our patient methoxyflurane and paracetamol due to her pain from her laceration in her arm and on her ankle. Prior to the shift, this is when you do your pre-shift checks, and all of the drugs in the truck and the bag would have been checked over. So the methoxyflurane carton would have been checked. You checked that the seal on the top wasn't broken, so nobody had tampered with it. Once you break the seal and take it out, this is when you check the capsule in which the medicine's in, and check to see that you're happy with it and that it hasn't expired. Generally, you'd ask your partner also to check the use by date just to be safe. Same as the paracetamol, you'd check that none of the tablets were broken and that the seal hadn't been broken and that you're happy with it, and you check the use by dates on those too. So whilst dealing with a fracture, you can use the acronym +DISC. This gives you signs and symptoms that it's most likely a fracture that you're dealing with. So firstly, the pain. You check the patient's pain scale from 1 to 10. Depending on the severity, this is when you give them their pain relief, and in this video we gave her methoxyflurane and paracetamol, and then you would check the pain scale again to make sure that it's slowly lowering and that the pain relief's working. Generally, when you're dealing with a fracture, their pain would be quite high. There would be a loss of function to the limb in which it has been fractured. They wouldn't be able to weight bear and unable to move it no matter how hard they tried. Unusual movement, and it will bend in ways that it shouldn't or normally wouldn't. And their swelling, it could swell, but it's not always present in the early stages of the fracture. It is normally quite deformed, could be angulated, or there could be a bone sticking out of the skin. It could be, you check the irregularity, you'd compare it to the other foot and check the differences between them. Could be shortened and or rotated, generally happens in the leg. Correctus on palpitation, this especially happens in the ribs. When you move them, you can hear crackling noises. And the patient could be in shock, especially if they'd fractured more than one bone.